everyone, and welcome to the Smile Code podcast, where we explore the intricate connections between various aspects of our well-being. I'm your host, Dr. AC Kwedu, and today we're diving into the profound impact of oral health on holistic health and emotional well-being. So far in the series, we've explored broad concepts surrounding our emotional, mental, and psychological well-being. But in the next few segments, we will delve into one of the foundational elements of holistic health, which is our oral health, and its direct impact on our well-being, our happiness, and our pursuit of smile mastery. So stick around as we uncover how a healthy mouth can lead to a healthier, happier life. So let's start with a simple but crucial question. Why is oral health so important? Most of us think brushing and flossing as our ways to prevent cavities and keep our smiles bright. Now, while that's true, the greater truth is that the state of our oral health is deeply connected to our overall physical health, which in turn affects our very existence. A number of years ago, a patient of mine referred her husband to me. She stated that he never smiled, was always grumpy and dissatisfied at home and at work. He had grown a long mustache to hide his teeth and hadn't been to a dentist in years. I agreed to see him, and we found him an appointment. When he came in, I was startled to see the length of his mustache. She was right about that. And not only that, he was withdrawn, he was hunched over and didn't seem very happy, in sharp contrast to his wife, who was quite personable. And I could tell he didn't care to be there. Well, I examined him and found some really bummed out teeth in the front, which would explain the mustache. I also found some swollen and inflamed gums, many areas of moderate to advanced gum disease, and a number of very deep cavities in his molars. This guy had obviously been having a lot of pain and discomfort, which would explain all of what his wife had described to me. Anyway, so after a couple of consultations, he agreed to get his mouth cleaned up, his teeth fixed, and his bite, his function, and his smile restored. With each visit, I noticed a change in his attitude and personality and a trim of his mustache. By the time we completed his work and restored his oral health and enhanced his smile, the mustache was gone. His hair was clean cut, his wardrobe was transformed, and he was standing tall, pleasant to be around, and even had on some cologne. He looked good, and there was no doubt that he also felt good. He had undergone a complete physical, mental, and emotional transformation, it seemed. His wife later sent me a thank you note. She said, "I had no idea fixing his teeth would change his life so. He's happy, he's smiling all the time, he's doing so well at work. And as for my marriage, it's better than ever. You saved my marriage," she said. And that really warmed my heart. Poor oral health can lead to a host of systemic issues that affect our bodies far beyond our mouths. So let's explore some of the systemic effects of poor oral health. There are significant impacts of oral health on multiple body systems: the cardiovascular system, the endocrine system, the respiratory system, the digestive system, the reproductive system, the immune system, the skeletal system, the cognitive health, our oncological health, and our sexual health. Poor oral health, particularly periodontal disease or gum disease, leads to systemic inflammation and bacterial entry into the bloodstream, which increases the risk of heart disease, arterial plaque buildup in our, blood vessels, and strokes. In diabetes, periodontal disease complicates blood sugar control and worsens diabetic complications, creating a bidirectional relationship where each condition exacerbates the other. Oral bacteria can be inhaled into the lungs, causing and worsening respiratory infections like pneumonia and exacerbating chronic conditions such as chronic obstructive pulmonary disease, or COPD as they call it. Oral bacteria can travel to the gut, potentially leading to gastrointestinal infections and exacerbating conditions like inflammatory bowel disease, or IBD. And oral pain can also impair chewing, leading to poor nutrition and digestive issues. Gum disease or periodontal disease is also linked to adverse pregnancy outcomes, including preterm birth, low birth weight, and preeclampsia due to systemic inflammation and bacterial spread. Chronic oral infections weaken the immune system, making the body more susceptible to other infections and autoimmune diseases. And periodontal disease is associated with osteoporosis and rheumatoid arthritis, as inflammation can lead to bone loss and joint issues. There are studies that link gum disease to cognitive decline, including an increased risk of Alzheimer's disease due to the systemic inflammation, which affects brain health. Poor oral health increases the risk of certain cancers, such as oral, esophageal, and pancreatic cancers, due to the chronic nature of it, the inflammation and the bacterial infections that result from it. And if the story about my patient earlier is any indication, gum disease contributes to erectile dysfunction by impairing vascular health and blood flow, which is critical for achieving and maintaining sexual performance. Now, let's talk about the connection between oral health and mental well-being. Imagine dealing with chronic tooth pain, as my patient earlier did, or feeling self-conscious about your smile. In his case, he grew a mustache, which is just, a temporary solution. The teeth were bumped out, they were decayed, they were painful, but he was embarrassed. And because of that embarrassment, he grew a long mustache to cover his teeth. Tooth issues or oral health, poor oral health can significantly impact mental health. Chronic dental pain can lead to stress, can lead to anxiety, and even depression. It's hard to feel happy and motivated when you're constantly dealing with discomfort. And then there is the social aspect. Missing teeth, bad breath, or noticeable decay can make you feel super embarrassed and lead to social withdrawal. But when your mouth is healthy, it boosts your confidence and self-esteem. You're more likely to smile, to speak clearly, and engage with others, enhancing your social interactions and overall happiness. A healthy smile will enhance your communication, helps you to speak clearly and effectively, which is vital for both personal and professional relationships. Good oral health encourages you to participate in social activities, fostering a sense of community and belonging. Imagine avoiding social events because you're self-conscious about your breath or your teeth. It's not just about aesthetics. It's about the confidence to engage and connect with others. So what can we do to ensure our oral health supports our overall well-being? Well, we have to prioritize preventive care. Regular dental checkups are so important. Regular cleanings, proper oral hygiene practices like brushing, flossing, can prevent many dental problems before they even start. Investing in your oral health is cost effective in the long run because preventive care is generally less expensive than treating severe dental issues. Plus, it saves you from the pain and discomfort associated with oral diseases. Maintaining good oral health allows you to enjoy a varied diet essential for good nutrition. It enhances the quality of your life, frees you up from the burden of oral pain and discomfort. So, in summary, oral health is not just about having a bright, beautiful smile. It's a cornerstone of overall health, well-being, and happiness. By maintaining good oral health, you can prevent serious health issues, enhance your mental and emotional well-being, and improve your social interactions. So let's make oral health a priority. Schedule your dental checkup, brush and floss daily, and remember, a healthy mouth leads to a healthier, happier you. Thank you for joining me today on The Smile Code. Stay tuned in later episodes with more insights on how to live a balanced, healthy, and joyful life. Until next time, remember to keep smiling. This is Dr. AC Quadu signing off. Remember, a smile is the best accessory you can wear, and it starts with good oral health. Take care and see you soon.